Namaskar, good evening. I'm Dr. Rahul Pandit, and you're watching the 605th non-stop edition of Dr. KK's Med Talks. Let's have the headlines of the day. According to the data from the Union Health Ministry, after nearly 2 years, the number of daily new COVID cases are below 4,000 cases. The last time the cases were below 4,000 was on 16th of May 2020 with 3,970 cases. On Tuesday, Hong Kong reported more than 43,000 new infections after the launch of an online self-reporting platform. It saw a huge jump from 25,000 cases which were reported on Monday. The global COVID-19 death across the globe has crossed 6 million on Monday, according to the data from Johns Hopkins University. The WHO is monitoring the BA.3 sublineage of Omicron to study if it causes more severe disease than previously known. Israel has detected the first polio case in the country since 1989 in a fourth-year child in Jerusalem. According to the health ministry, the child was not vaccinated. This brings us to the topic of the day. Let's go to the topic of the day, which is Women's Day and COVID-19. Can I have my brother, my colleague, my mentor, Professor Dr. Shashank Joshi join up, as well as the guest for the day, Dr. Anita Mathews join up. So, Professor Joshi, accomplished endocrinologist from Leelavati Hospital. He is a Padma awardee, and obviously he's been the face of the Maharashtra COVID-19 task force. And welcome, sir. I would like to give you the opportunity to introduce our special guest for today. It's a Women's Day, and we are very lucky to have somebody who has been a very, very prominent figure in the fight against COVID-19 in the last 2 years. Over to you, Professor Joshi.
Thank you, Rahulji. Thank you so much, and welcome, Dr. Anita Mathews. We are
Thank you,
indeed
sir.
delighted and privileged that you consented to be on the show. I had a very special reason why we have called you here today. Today's show is on women's health, and COVID is almost over. And you will wonder and think why I thought and Rahul thought that we should have you on board. And I'm drawing your attention in the months of April, May, and June of 2020. And my younger brother Rahul was struggling with COVID, and I was communicating with you. And we never thought, Anita is one of those unsung heroes in our COVID fight with Rahul from the Fortis table. She has been very, very well groomed and well educated physician. She developed a special interest in infectious diseases. She trained at the world famous GS Medical College and KM Hospital. She has published extensively, done cutting edge research in the field of infectious diseases. In the pre-COVID era also, she had made a mark for herself. She is a visiting faculty to the Lokmanya Tilak Medical School and Sion Hospital as an attending physician there. She is involved with various global clinical trials. She gives a lot of seminars on infectious diseases. She steers with Rahul very closely and works on the antimicrobial stewardship program for the Fortis group. And in the COVID, she was at the forefront again. In the COVID care protocols, COVID management, hospital management, office management. So she has been really at the forefront. Today is the Women's Day. We salute women. As I said on my previous Marathi show, that biologically and endocrinologically, women are the superior sex compared to men. So we bow down to them. And Anita, I am so grateful that in this time of Lent, you have lent your time to us for the next 30 minutes. And we really want to learn from you. And I'm going to start, and then probably Rahulji will add. What has been your journey in the last 2 years as an infectious disease specialist, handling an unpredictable RNA virus? How was it different? Because with a career in infectious diseases, how did you see this whole COVID challenge? And maybe you can tell us your little quick journey of the COVID times. What you felt like and how you see those three waves now. All the three waves are gone now. The first wave is gone with the ancestral Wuhan strain. The second wave with the deadly Delta strain with a little tinge of Kappa there. And then, of course, we had this Omicron strain predominantly, which also, according to me, is gone now. I don't think there's much left there. There's hardly any tail also. So, how do you see all this whole spectrum of COVID? And also, then I want to know from you that women did much better. COVID showed the world that woman is a biologically better sex. Why do you say so? Because when it comes to cardiac diseases, when women lose their menopausal state and they get menopausal, and that estrogen connection goes away, their mortality goes up. But when it came to COVID, we clearly see the outcomes, men and women. There was a clear-cut gender predilection for a protection. So women were more protected and biologically superior as a sex, even in the COVID times. So Anita, it's all yours now. You are our showstopper for the day, and we thank you for being with us here. And then, of course, Rahul will have the next, battery of questions. He loves to ask us a lot of questions from our viewers, but I'm just making it very simple for you. Everybody wants us to know what was your journey in the last 2 years, three waves, and some real time, insights after 2 years.
Thank you so much, sir, for the kind introduction. It's indeed a privilege to be a part of this particular show. I would like to thank both of you for having me here today. On the occasion of the International Women's Day, I would like to thank all the women viewers and all the men as well for being supportive to us. And a very happy Women's Day to all the women watching the show. In terms of what was the feel, what was the kind of uh, the way we looked at the COVID to begin with, in the month of March of 2020, I think we were absolutely clueless. We didn't know what exactly had actually struck us. So in terms of how we would be going around in with the pandemic, to be honest with you, we just took it one day at a time. I don't think we had any plans to how do we go about with it. Dr. Pandit is a party to the whole thing. We would actually have brainstorming sessions every single evening, trying to chart out the course of what is to be done for the next day, and that I think went on till way into the whole of the first wave. In fact, we used to do that on a regular basis with the entire team of ours, and it was every single day a learning process. So none of us knew what exactly needs to be done, but we kind of probably improvised on what we knew, and that's how we went ahead, and which stood us in good stead. So we did well at the end of the first wave. We were able to really figure out what needs to be done, and how we can reduce the mortality. The ICU team that we have in Fortis is excellent, so they were able to cut down the mortality big time. So that actually gave us a lot of courage to actually face the waves as well. So the subsequent two waves, I think, were a little better in terms of the managing capacity vis-a-vis the intensivists, the ID physicians, and the physicians team put together. We were in a better position to handle it. The second wave, of course, was a huge onslaught. So we had huge number of admissions, a significant amount of mortality. Though I think the mortality figures with us were actually better off than the rest of the uh, city state. But having said that, we actually we learned during that particular period how to go about, and we did things which we thought we were not capable of, or maybe we never thought we would be able to manage the pandemic in this particular manner. But it was all overwhelming kind of a response that we ourselves felt at the end of all the three waves. The third wave, we were more or less braced for it, and we were braced for it. So it was easier to handle the third wave as against the first two. But as yes, being a team, having a kind of a teamwork, uh, it really helped us quite a bit. So I would say, as a women, the challenges were only at the home front, but they were not in the front in terms of the work. The challenges for a woman is always at home. As a clinician, whatever you are trained to do is what you do. So I think wouldn't want to really glorify the women in that particular manner. Yes, we are supposed to do what we are supposed to do. We have been trained for it. But yes, the challenges are more at the home front, where you also have a mother, a wife, a daughter-in-law. So those wearing those hats are the difficult part of it.
Anita, I mean, we've been a part of the whole journey for COVID for last 2 years together as one team. And, you know, I think you actually, in the last sentence, you brought out the stark difference. You brought out the stark difference that I did not have to wear any of those hats at home. I was just coming home and I had somebody to look after me at home. I want you to, if it's okay with you, I want you to just sort of uh, maybe just brush up a little bit and tell us that how did you manage the home front as well, because you managed it so well that at the work front we did not feel that you were actually having any home front problems or difficulties or wearing so many hats. You were just so seamless in the work front that how did you actually step up to the difficulties at home, because home was a complete different challenge this time. There were lockdowns there, you did not have groceries delivered. The normal people who would come and work with you at home, like our the driver, for example, or the maids who are there, they were also not there. So how did you actually step up to both of them and still have this smiling face today, despite 2 years of very very hard, long hours in the hospital?
Uh, I would say the lot of credit would go to my family. I had a big support in the form of my husband, my mother, my mother-in-law, and my two children. Of course, my two children were too small to really go ahead and do the things which were right. In the last 2 years, I've realized that they have all grown up without me having witnessed that particular phase in their life. But having said that, my better half, I would like to call him my better half, because we say behind every successful man there's a woman. I have a man here who's been the reason for pushing me to do better in terms of my work. And both my mother and my mother-in-law, both of them are educated, well educated working women, and their times they are well close to their 90s, but they were the reason why I could solely go ahead and perform what I could, because a lot of the things and pressures at my home front were taken care of by them. Yes, it was a little challenging, because in the initial phase, I used to actually feel that I'm going to go ahead and infect all of them. So I decided to stay a little away from them. I used to be sitting in my room all alone after coming back from work, because every single surface that I used to touch, I used to feel I probably might land up contaminating that. So things that we were not really well versed with it in the initial bit. So the first 2 to 3 months were a bit of a challenge. As far as cooking and the rest of the things are concerned, I think I probably help other people to also form a means of livelihood. I used to order food from outside and used to have catering services cater to my needs in the family. Yeah, but then we also learned in the typical Hindi, the Mumbaiya Hindi parlance, the jugaad of how to go about doing things. And at the end of it, I think every single person, my friends, everyone actually uh, helped out in some way or the other. And I think that has been the saving grace for me during those times. When I think back on it right now, I can smile. At that time point, maybe I wasn't smiling so much.
Sir, off to you. Over to you.
So, Anita, let's move to some science. I agree that you have done a commendable job. You are dealing with unknown virus. Virus needs antivirals. The antiviral space was poorly clouded. Everything was repurposed, and everything was nobody knew how to handle it. We saw H1N1, we see flu. How the treatment protocol evolved, and how could you contribute it? How could you get that sixth sense? Because as you rightfully said, that in the first wave we grappled with unknown and no medicines. Everything repurposed, starting from the journey of ivermectin or hydroxychloroquine, and then we moved to the remdesivir story in the second wave, and from there we really moved into a molnupiravir, monoclonal antibody, and virtually paracetamol and anticoagulants in the third wave. So how did this whole journey come about? And as an infectious disease physician, suddenly you found that every person who's a medical doctor or not a doctor suddenly became a doctor. So, like, Rahul asked me when I met him for the first time, how come you are into infectious diseases? So I told him that I had experience when I used to work long time back in infections, in internal medicine, working in HIV/AIDS and public health. And that time I was fully trained in it. And then, of course, I went into endocrinology. Pandemics always pull you back, but you are fully corely specialized in infectious diseases. So I want you to start with what made you take infectious diseases and how we want to have more and more women in infectious diseases. And second is that because according to me, it's a core specialty now, and COVID brought it on the spotlight. And how did you look at COVID treatments, in each wave?
Uh, Coming to the first half of your question, sir, how did I land up taking up an ID? So, I don't have a formal MCI recognized ID degree as such, because when I did my course in infectious diseases, it was an infectious disease a 1 year course which was offered by KEM Hospital at that time when I was working as a lecturer. It was a course between us and Hinduja Hospital, and this was way back in 2002, the year 2002, which when I think we did not have any formal courses here in Mumbai. Why I chose to take up that particular topic, one of my teachers during my MBBS days was Dr. Rajiv Soman. Dr. Soman was so much into ID that we all kind of probably got really taken in by him in the way he used to diagnose things, and that's how I landed up taking it. I decided to take it up as a core specialty. I actually was to go abroad for my training when I lost my father. That was in the year 2003, when I had got a fellowship abroad. After that, I decided to stay back in the country with my mother, and that's how I kind of completely went on, branched on into it. And in KEM, fortunately for me, I was in a unit which used to deal with HIV/AIDS, and then we started off with an ID clinic, and then we started with the courses in ID as well in KEM, and that's how my journey in the whole thing began. I'm glad to see that there are many more MCI recognized DNB and FNBs and now DM as well, which has come up in ID over a period of time, and we keep reiterating that we need more and more people coming into this particular field now that it's a core specialty by itself. Uh, um, in terms of how the treatment modalities have changed uh, during the course of the COVID treatment, in the initial phase, I think everyone started targeting it with HCQS, uh, followed by, I think, the doxy and the ivermectins. Then we also tried using the anti-HIV agents like lopinavir, ritonavir, in and I think azithromycin, I think name it, and all the molecules were used. Most of them without really having any substantial basis to it. There was hardly any evidence, but the evidence keep on coming as you start using the molecules. People did think that they were repurposed drugs. Towards the end of the first wave, we started seeing some, you know, light in the form of remdesivir, which I think is a beautiful drug. I think it works beautifully in patients who are critical and where you time it right. You can't give it for all patients, it's not meant for all. So once we had that in the kitty, and I think early in the first wave itself we realized that steroids work beautifully in them, in these patients. And that's when we started using that. Anticoagulants and steroids, I think, were the crux even in the first wave, which have continued right up to the third wave in patients where it has been indicated. In fact, the anticoagulants, I think we have scaled down big time now in the third wave as compared to what we used to use in the first two waves. um, as far as the other oral antivirals are concerned, like your favipiravir and the molnupiravir, favipiravir I don't think really took off all that well, and with molnupiravir again we are seeing that we are using it only for a certain subset of patients. There have been a lot of adverse comments which have come in for the same as well. But I think in used in the right kind of a population, in the right kind of a patient, it would probably show a good result. Um, Now we know that, like any other viral illness, what we need to do for majority of patients of COVID would be in the form of supportive care, which is all that we need to look at. Only in the critically ill patients, or the ones where you know that there is a high chances or likelihood that the patients would progress into severe form of the disease, would you need to do anything. And the boon for us has been in the form of vaccination, which has come up in the year 2021, that we started inoculating our population here, and that has done wonders. That has actually reduced the severity of the illness. It has reduced the kind of uh, the onslaught of the illness that we used to see in the pre vaccination days. I think that's been one big boon. We may not have been able to curb the illness completely, but yes, being a RNA virus, we know that it's going to be difficult. We might land up having some kind of a shot, like a flu shot, on a yearly basis for this as well. We don't know how the tide would be in the next couple of weeks, months, years. But yes, it's very, very hopeful now as compared to what it used to be in the past. I think there are newer drugs in the pipeline as well, which should probably be able to give us a better result than whatever we are currently using. Uh, I, I think I would like to end there. I mean, I don't know if there's anything more that I
I
can
think you
Thank you.
really talk
covered the
about.
Now we can
entire.
ask.
I think you covered the entire spectrum there. I was also amazed that you had such a good memory. I had almost forgotten Rutinavir completely, because we are just wondering that was that being ever used. Anyways, I'm going to come to some of our viewers' questions. So, Mr. Tapadia, he's been struggling with long COVID. He says in the 10th, I believe it must be 10th week or 10th day, or 10th month also possibly. So I just want you to talk about a little bit about long COVID and the long COVID and the post COVID OPD which we started, because you were one of the first physicians along with us that we actually started the post COVID OPD, and a significant number of patients have come and seek your help for post COVID OPD. So if you could just guide this gentleman, he hasn't talked about what symptoms he has, but maybe if you could just guide him and help him out where he can seek help, that's what's required.
Uh, So the spectrum in long COVID that we have seen have actually spanned couple of weeks to actually couple of months. I actually have a patient who's now 2 years into a long COVID, and she still has symptoms. So I think it would be the take is that it will be different for different kind of a population, and depending upon what were your symptoms that you started off with. So the typically the patients who would have had a more severe disease are the ones who probably will have a long COVID kind of a phenomena. We also know that it could span from high grade fever, which can be persistent post COVID, to severe fatigue, loss of memory, what we call as brain fog as well, a little bit of clouding in one's uh, senses. We could have aches and pains. You can have difficulty in walking. People have had a history of strokes during this time, heart related events, all of these. And of course, what I have seen in my practice is a surge in the number of TB cases as well. I can't call TB as a part of long COVID, but yes, COVID can cause each of these spectrums that we spoke about. Unfortunately for us, there is no single drug which can actually help you in recovering a long COVID. People do come in and ask if there's any immunity booster that can be taken in the form of, an XYZ medication which could improve their immunity system. What we need to understand is the long COVID typically happens because your immune system has worked overtime during COVID. So probably that is one of the reasons why you tend to have symptoms which are long lasting as well, because these are all kind of hyper inflammatory responses that we look at. Um, Now, in terms of what we can do for these patients is depending upon what are their symptoms, we can give them symptomatic treatment, help in the form of physiotherapy, if indicated, then medications, and last but not the least, if there is a need, then help in the form of counseling. Now, we do have a post-COVID OPD, which we run on a daily basis. Dr. Pandit is the main force behind it. He, along with the the three of us. There are two other physician and ID colleague as well. We all do the COVID OPD every single day. So the gentleman can touch base with any one of us. I'm sure there's similar thing which is happening around the city, country as well. So they could seek help from there too.
थैंक यू वेरी मच अनीता. आई एम गोइंग टू आस्क प्रोफेसर जोशी अ क्वेश्चन बिकॉज अश्विनी जी जो है वो एक सवाल पूछ रही है और मेरे ख्याल से जोशी सर आप ही हैं जो कि इस सवाल का बहुत अच्छे से उनको जो है उत्तर दे सकते हैं. वो पूछ रही है कि क्या अब आगे कोई कोविड का नया स्ट्रेन आने वाला है या सिर्फ हाइप क्रिएट की गई है इसके ऊपर. ये चर्चा में हम बहुत विषय जो है ये बहुत चर्चा में है. इसका शायद सही उत्तर किसी के पास ना हो पर मेरे ख्याल से साइंटिफिक बेसिस पे और एक्सपीरियंस के बेसिस पे कोई अगर उत्तर दे सकता है तो आप है जोशी सर. बताइए प्लीज.
राहुल जी धन्यवाद और अनीता जी धन्यवाद. अश्विनी जी आपका प्रश्न बहुत महत्वपूर्ण है और हमारे जितने श्रोतिया महिला है सबको मेरा सादर प्रणाम. आज का महिला दिन है, जागतिक महिला दिन है. इसके लिए नया वेरिएंट आ सकता है क्या कोविड का? बिल्कुल. जैसे अनीता जी ने हमको बताया कि कोविड ये आरएनए वायरस है, स्लोली म्यूटेटिंग वायरस है, तो उसका नया नया स्ट्रेन तो आने वाला ही है. तो जैसे वायरस कपड़े बदलता है वैसे उसको स्ट्रेन बदलते हैं. जैसे आदमी लोग हम हर साल हर सीजन में अलग अलग कपड़े डालते हैं. अभी गर्मी का मौसम आ गया तो हमारे कपड़े अलग होते हैं, ठंडी के मौसम में अलग होते हैं. वैसे वैसे वायरस भी अपने कपड़े बदलते रहता है. लेकिन उसकी जो तीव्रता है, उसकी जो घातकता है और उसको जी संसर्ग होने के जो प्रकार है इसमें फर्क आएगा. जैसे हमने देखा पहले जो चीन से आया था वुहान बेस्ड स्ट्रेन, एंसेस्ट्रल स्ट्रेन उसको कहलाते हैं, वो घातक भी था और वो स्प्रेड उसका चलता था. लेकिन उसके बाद 4 प्रकार के स्ट्रेन आए जिनको ग्रीक अल्फाबेट में लिखा गया था, अल्फा, बीटा, डेल्टा और गैमा. उसमें से डेल्टा का जो स्ट्रेन था वो भारतवंश में आया. वो हमारे जो लंग है फुफ्फुस में जाके उसमें से जानलेवा स्ट्रेन बना. उसके बाद जो स्ट्रेन आया वो साउथ अफ्रीका, बोट्सवाना और अफ्रीका से आया जहां पे अनवैक्सीनेटेड पॉपुलेशन ज्यादा था अफ्रीका में, और वहां से आया ओमाइक्रॉन. इसका संसर्गता मीजल्स या चिकन पॉक्स इतने फास्ट था लेकिन वो नाक और घसे में ही था, फुफ्फुस में या लंग्स में नहीं चला गया. तो इसलिए ये जो नया स्ट्रेन आया तो उसको 3 प्रकार में डिवाइड किया जाता है: वेरिएंट ऑफ कंसर्न, वेरिएंट ऑफ इंटरेस्ट एंड वेरिएंट अंडर इन्वेस्टिगेशन. अभी कोई नया स्ट्रेन दिखता नहीं है. बहुतांश पूरे दुनिया में अभी ओमाइक्रॉन ही है. ओमाइक्रॉन के 3 छोटे छोटे सब लिनिएजेस है, BA1, BA2 और BA3. उसमें BA2 अभी प्रेडोमिनेंट है लेकिन ये भी चला जाएगा और उसके बाद और कुछ आएगा लेकिन उसकी संसर्गता ज्यादा भी होगी तो भी उसकी जो तीव्रता है, उसकी जानलेवा जो पोटेंशियल है वो कम होगी. तो हमको यही मनोकामना है कि आने वाला जो नया स्ट्रेन होगा उससे कोई बड़ा डिसरप्शन नहीं होगा. WHO एक 2-3 महीने में पैंडेमिक को खत्म डिक्लेयर करेगी और ये स्ट्रेन एंडेमिक हो जाएगा जैसे डेंगू है, मलेरिया है. इसके बारे में हम अंग्रेजी में अनीता जी से एक विश्लेषण लेंगे ही. मेरे को लगता है इससे आपको काफी एक क्लैरिटी आ जाएगी अश्विनी जी कि ये आने वाला स्ट्रेन जो है, अभी लगभग कोविड खत्म हो गया है लेकिन अभी भी हमको मास्किंग करना चाहिए, टीके लगवाना चाहिए क्योंकि अभी भी पूरा खतरा टला नहीं है क्योंकि ये हवा से आने वाला स्ट्रेन, एयरबोर्न ड्रॉपलेट इन्फेक्शन है. तो हम अनीता जी को यही प्रश्न पूछेंगे अंग्रेजी में. अनीता, आई हैव एक्सप्लेन्ड देम इन हिंदी but we would like to tell everybody the likelihood of a new strain and the importance of COVID appropriate behavior in the near future.
Right, sir. See, जैसे डॉक्टर शशांक जोशी सर ने कहा, we know that these are RNA viruses. All RNA viruses have a capacity to actually mutate big time. So they keep on mutating, and the mutation is in the favor of the virus because they will prevent the virus from dying in our body. But the whole idea of the virus is not to kill us, it's just to replicate in us so that it can transmit from one person to another person. This is a natural history of any virus. This is not the first time that a virus is behaving in this way. So if you would have known in the past, there's another virus which you have not been able to really eradicate from the world, which is HIV, which is also an RNA virus, which keeps on mutating. The reason why we keep on giving the medication to those patients is because it keeps on mutating and harming our immune system. Fortunately for us, the COVID virus has a very shortened life in our body. It is only for a period of 7 to 10 days. So in we do know that as a norm the virus will mutate. Whether the mutations are very different from what the present strain is, or the mutations are going to be just one or two mutations here and there, only time will tell, and it will all depend upon how the virus mutates. Ultimately, at the end of the day, you would have different strains which will still come up, whether they cause a severe disease, whether they cause no disease at all, whether they cause just mild infection, or occasionally whether they can cause severe infection. Only time will tell. We will have no way to really determine how the virus would mutate in future. But what we do know is that the more number of people in the world who get vaccinated, the lesser the mutations are going to be. The mutations are all going to be driven by the people who do not get vaccinated. In fact, it's a known phenomena that if you do not get vaccinated and the virus enters you, then you are the person in which the virus will learn how to mutate. So it's important that all of us get vaccinated. The more vaccinated we are, the better chances that we have that we do not have these future endemic spread of the infection. So that means an infection which spreads into a smaller locality, like it would happen now with H1N1 or swine flu, as we popularly call it as. So that's the normal norm. So yes, this is something that can happen technically, and this is not something that has actually been spread like a, it's not an afwa, like what people normally think that is, pushed by the medical science. No, it would happen over a period of time, but it need not be in a very virulent manner.
Thank you so much. Rahul, I have a question for you. Dr. K.M. Prasanna Kumar is asking, how can we use, can molnupiravir be reused in reinfection? You're muted, Rahul.
Sir, you're muted, sir.
Yes, molnupiravir is a drug which unfortunately came under a lot of criticism, but it's an excellent drug in terms of its viral clearance and stuff. Obviously, it was started getting compared to the Pfizer pill as well. But if you look at the viral clearance, molnupiravir has got a reasonable viral clearance, and even in reinfections, I think it has got its pace. We need to choose the population correctly. Which is the population? So what was the criticism was based upon younger age group, which is growing population, children who have still bones and cartilages to mature, and the reproductive age group where there was a talk about teratogenicity or mutations. And I think if we exclude that population out and use it in population which is elderly, above 50 or 60 years of age, with one or two comorbidities, who have got a chance that the infection which they are actually harboring has got a possibility of causing severe or moderate infection, please use molnupiravir even in reinfection cases, and you would get reasonably good results, is what we believe. Obviously, as we gain more and more experience about the drug, we will come to understand it better. But from the knowledge of the trials which have been published up until now, and from the limited clinical experience of the last 2.5 3 months, this is what I could decipher out of it. We would
Thank you. Thank
probably
you.
change or add a little bit more to it. Sir,
Thank you so
couple
much.
of
Yeah.
things, and then I think we can
We can
start.
take Pradeep Sarvaya's question to Anita.
Correct.
Anita, you made this passing mention. So Pradeep Sarvaya is asking a very good question. Is there any chance of COVID to remain in the body dormant? Like they say, chickenpox virus stays dormant in the body and later on comes back as herpes zoster.
Uh, that's actually a pretty good question, and I don't have an answer to it, because in the last 2 years, I've not really seen patients coming in with any kind of a shingles kind of an episode. I'm not saying typically shingles, but any kind of a post-COVID, some other infection which is related to COVID. I've not seen it. We don't know. I think we are still pretty early in the disease. Just 2.5 years from the time that the pandemic has begun, I don't think we have all the answers. So as of now, the answer is I don't know.
So I think, most of the COVID, the answer was I don't know. And we still are learning. You are absolutely right. And I think the herpes zoster, what we see is only after sometimes vaccines. There
Yes.
is actually what happens is that the dormant virus comes out. And I think me, Rahul, Anita, we all have seen that happening after the COVID vaccine. Having said that, Rahul and Anita, now I want to ask you, Anita, as a woman who has seen this pandemic, on the Women's Day, what is your message for all the women out there, both in the healthcare profession and people at large? And second is your take-home message for COVID.
Uh, Coming to the first question, the first part of the question, uh, in the healthcare sector, I think women have really managed the COVID pandemic very well. In fact, maximum number of our staffs in terms of the nursing staff are all women. In fact, 90% of them. And the way and these are kids. I would call them as kids because they're all in their 20s. When we sit at home, we were scared of how our children would get infected. And here you have girls who are in their early 20s who were battling it out with us there. And I think that actually would mean a hats off to them, because their parents obviously must have been worried like everybody else's are. So we actually upped our own game by giving the 100% that as a healthcare worker. So I think when it comes to breaking any glass ceilings out here, I think I shouldn't be comparing a man and a woman here in the healthcare sector. I think both of us are walking step by step. So I would not want to differentiate and say that we are any different. I would say that we were equal to men in terms of managing the pandemic. In terms of how things would have been without, in the non healthcare sector, I think here again women managed the home front, the work front, and the work from home, which I think is a lot of ask. If I look at people who are working from home, I think they're working more than 24 hours now. If there was anything like that, they would be probably working 24 by 7, 365 days. Because earlier when you used to go to the office, you used to have at least curtailed time points. Now everyone is working all the time sitting in front of the laptop. So for women who were working from home, it would have been exceptionally more difficult. uh, Secondly, for the women who are housewives or homemakers, they would have probably been inundated with the kind of uh, the chores that they would have to do at home front, because there was no maids, no help, taking care of children who are studying in the school, plus taking care of the husbands who are now sitting at home and working from home. So all of that would have made it much more challenging. So I think it was challenging time for women, and they've made they responded well to this particular challenge. In terms of how would you be looking at COVID in future, I would still reiterate, follow the COVID appropriate behavior. Masking is reducing not just the risk of COVID, but a lot of other infections, the pollution, everything put together as well. So there's nothing wrong in wearing a mask for whatever time frame that you can possibly call it towards the end of pandemic. On my front, I'm intending to stay put with my mask in the hospital, because I feel my cold, cough, and fevers have gone down substantially ever since I have been masking myself in the last 2.5 years. So I feel that we just need to follow the COVID appropriate behavior, eat healthy, and most importantly, as a women, uh, we should exercise on a regular basis, because that's what is going to keep our immune system healthy as well.
Great. Rahul, you can sum up the show, and Anita, thank you so much.
Thank you so much, sir.
I completely agree and endorse, and we really bow down to you and all the women today. And Rahul, you will have the last word.
So, sir, essentially my last word is exactly what Dr. Anita said, that we need to still keep on watching the space for COVID in terms of masking. And masking not only just helps us from the other, not only from COVID, but it actually helps us from other infection as well. Um, Having said that, I think we should not let our guard go down. Please continue with the masking. Please continue with your vaccination programs as per the Government of India guidelines. The government is doing a fantastic job in issuing the guidelines, making the vaccines available. And I think we as citizens should at least bare minimum be following that. And if you follow that, as Professor Joshi said sometime before, that pandemic may be towards its fag end or the tail of the pandemic remaining, but we don't know how long the tail is. It's a very famous quote of Professor Joshi: "Long and fat tail." So we hope it's not long and it's not fat this time, and it quickly ends off. Sir, any last words from me before I sum up the show?
No, no, no. I think we are good for the day, and thank you, Anita, so much. Thank you, Rahul.
Thank
And
you
I
so
think
much, sir.
let's look at brighter future. You know, break all the barriers so that, as I said, biologically women are a superior sex, and we'll ensure that there is gender parity for them everywhere. So here also we can see that there are two men, and so I think we need to have a gender parity and gender equality across the world. And it's not just for India; it's across the world. And I think be careful, be safe, be responsible for COVID. So Rahul, let's
Yeah, thank you very much. That will be all for today. Thank you, Anita. Thank you, Sashank sir. We will be back next Tuesday with yet another episode of Jopa Show. Meanwhile, please keep watching Dr. KK's Med Talks. Namaskar.
Thank you so much.